Attendees are in listen-only mode.
Hello, everyone, and welcome to today's webinar, Critical Elements of Integrative Leadership. My name is Tamara Moore with the Reese Group, a communications firm in DC. I will serve as today's moderator. Before we get started, I'd like to go over a few items to help you participate in today's event. On the screen, we've taken a screenshot of an example of the attendee interface. You should see something that looks like this on your own computer screen in the upper right corner. If you have joined today's webinar by telephone, please enter your PIN number, which can be found on the audio pane of your control panel. All attendees will be placed in listen only. You will have the opportunity to ask questions during today's discussion. To ask a question, submit your text questions through the Q&A section of your attendee control panel. We will collect all questions and address them during the Q&A session at today's presentation. If you have a technical question, you can type your question through the Q&A section of the attendee control panel, and someone will respond to you as soon as possible. You may also contact GoToWebinar technical support by dialing 888-259-8414. Today's presentation is being recorded and will be posted on the Leadership Program website in the coming days. For today's call, we have brought together two experts who have helped to shape countless leaders in healthcare, as well as the integrative health space. We have Dr. Adam Perlman, who's Executive Director of Duke Integrative Medicine, Associate Vice President for Duke Health and Wellness, as well as the Program Director for the Leadership Program in Integrative Healthcare. We also have with us Michael Aquilino, President and CEO of Innovational Services, and a member of the core faculty for the Leadership Program in Integrative Healthcare. With that, I'd like to turn the call over to Dr. Perlman to begin today's presentation. Adam?
Great. Thanks, Tamara. So it's really a pleasure, and I want to thank everyone for joining us, Michael and I. And a lot of the content, a lot of the concepts that we're going to be discussing today are things that we spend a great deal of time diving into during the year-long leadership program in integrative healthcare. And it's a picture of some of our graduates and current cohort and faculty and guests from our graduation this year. Next, please. I just want to start us off by spending a few moments speaking about this particular diagram because it is a core sort of foundational concept for the leadership program and something that we've developed and refined over time. And it really is about how to bring about sustained transformation, really cultural transformation within an organization. And it's those type of leaders that we're looking to develop with the leadership program. And it starts, perhaps not surprisingly, with self, right at the middle. And this concept we've actually explored and written about in a white paper called Pebble in the Pond. There's a website we'll give you at the end of the webinar that you can go to where you can get a free PDF of that and spend some more time reading about these concepts. But within that, the idea is that we as individuals want to be that pebble, right, that sort of make that splash within our various ponds, our organizations, our particular worlds, and then that splash ripples out and has broader and broader impact in our environments. And as I've just said a moment ago, it starts with self. And around the concept of self is this idea of informed mindfulness. And many of you may be familiar with the concept of mindfulness, this idea of being present and aware in the moment, something that's an innate human capacity, something that can be cultivated. Certainly things like meditation, mind-body stress reduction are ways to cultivate mindfulness, that ability to be present and be aware. But one of the things that became apparent is that simply being aware alone isn't necessarily all that is required to be an effective leader. And so let me just give you an example. If, for example, you might be someone who has difficulty with conflict and you need to have a conversation with a direct report or a colleague, and you perceive that conversation may lead to conflict, you need to be aware that can be an issue for you. Otherwise, you can inadvertently shift into sort of avoidance behavior. So it's important to be aware, okay, I'm perceiving that this may bring about conflict. I need to not avoid the conversation, and that's very important. But of course, that isn't necessarily in and of itself going to lead to the outcome that you're looking to accomplish. And that if you take that awareness and couple it with the skills and knowledge and attitude that's required, perhaps in this case, to shape the conversation the way that you want to shape it and the way that it needs to be shaped to get the outcome that you're looking for, you're much more likely to achieve that outcome. So this is this idea of combining these skills and knowledge and attitude with the very important concept of being mindful, being present, and aware. Certainly beyond working on self, the next step, and I think most of you would agree, a key component to ultimately our success is the relationships that we build with others. And in this case, we're calling them insightful, functional relationships. So we begin to have those relationships with those around us, understand their capabilities, hopefully they understand ours. We begin to learn how to work well with them. That then leads to sort of the next ripple, which would be teams and building effective teams and effective group dynamics. Those teams, as they begin to function well as individual teams and as teams working with teams, they can then spread out and do spread out more broadly across an institution. I think as those teams take whatever the concept or the change issues are more broadly to the institution, that's where you begin to see an evolution of the organization, this organizational evolution. As that evolution leads to success, attainment of goals as an organization and also as individuals, then very often the shift in the culture can be realized and an organization can achieve sustained transformation around particular issues and goals that they may be working on. So this is, again, it's something that we've explored in more depth if you have interest in it, and in this white paper called The Pebble in the Pond. And I just wanted to share it at the beginning to sort of level set, because it is really a key concept that we use throughout the leadership program. So now it's my pleasure to turn the presentation, the webinar, over to Mike Aquilino, and I'll just give you just a brief bit of background beyond what Tamara already shared with you. Mike is core faculty for the leadership program. He does the majority of the facilitation in front of the room work that we do when people come several times to meet together. He does some coaching individually throughout the year with individuals involved in the program. And I would say that he has been my executive leadership coach for a number of years now and has really helped me to transform the way I do what I do, certainly previously in New Jersey and now here at Duke. So with that, I'll turn it over to you, Mike.
Thank you, Adam. Thank you so much for the amazing opportunity to be in contribution to everyone's life today. I'm grateful to be with everyone. And I'd like to start with just sort of saying that when I think of integrative leadership, what I like to picture and what I like to envision is if you were to open up a gold watch, an old gold pocket watch, and you look in there, you would see all the wheels, dials, and mechanisms, and they're all dependent on one another, and they're interlocked and working collaboratively together, and they do it with precision. So when I think of integrative leadership, that's what I really think of. And I can tell you that there are many critical elements to integrative leadership. I'm happy to discuss them today and hope to leave everyone enlightened and with an idea or two that can be applied immediately within the world of work that makes a difference. So the first, I think, and foremost critical step is that there is a clearly defined vision and mission. That vision and mission must capture the organization, the team, and the individual's sense of purpose. There's an energy to it and an energy associated with that. There also must be clearly defined organizational values to be followed. Those values would absolutely map to what the sense of purpose is all about. And then inside of that, the values alone are not enough, because inside of that there also has to be a clear set of behaviors that actually map to the defined values. And then it needs to be communicated to all stakeholders And it needs to be communicated consistently until it becomes so within the environment or within the culture. You know, expected outcomes from this would be that it creates organizational team and individual alignment. It definitely improves effectiveness and efficiency, and it empowers an entire organization. So there are many, I would say, hours of work and time and so forth that are spent on this in order to make this happen, but it's absolutely, I would say, first and foremost. It's kind of difficult to be effective as a leader if we're not clear about where we're heading and what it is that we're actually setting out to accomplish. So next slide. The next step is to actually begin to develop what I refer to and establish what I refer to as the accountability in a framework in order for everyone to operate within. It must, frankly, have clarity and develop clarity in roles and responsibilities. The desired outcomes and objectives declared must be declared, and because they need to be measured. Measurability creates accountability. All expectations need to be outlined, your own and others of you. And just as an aside, I want to share something that oftentimes as leaders, we're very clear about what our expectations are of others. And one of the techniques or one of the strategies, one of the things that you can do to evoke excellence of others or from others and to demonstrate approachability is to ask them what their expectations are of you. It's a very effective tool in helping people recognize your approachability. The last thing is that you want to be sure to focus on the positive. What we tend to think about brings on more of what we're thinking about. So with regard to accountability, we want to make sure that we focus on the positive side, which is the core component of something that we refer to as a culture of accomplishment and the development of that. We want to grow and learn from our mistakes. In my experience, I think, through what I've heard over the last 20+ years, we all learn the greatest lessons in our lives from mistakes. So we want to learn from those mistakes and apply that learning for future. The expected outcomes of these things, frankly, are that there will be reduced confusion and upset within the organization and the team. There'll be higher levels of collaboration and teamwork. There'll be ownership, creativity, and improved results. In essence, I feel that what has to happen is people have to have a framework. They have to know what to be able to operate within. So having the accountability defined and the framework from which people can operate is definitely a critical component. Next. So communication and empathy. Communication and empathy is a critical step. You have to, as a leader, actively demonstrate approachability, especially today. And so there are many ways and many strategies which can enable that. One of the things I would share with you, again, is a tool that you can take from today's discussion, is that when people come to you and approach you and ask you, what should I do with this? How should I handle this? The immediate impulse or reaction is to say, do this, do that. As an effective thought leader, I would submit to you that what would probably help demonstrate approachability is to ask them what they feel they can do or what they feel they would do. And when they share it with you, listen very closely, actively listen, and if it's on point, acknowledge and say simply, that's exactly what I would do. That will actually begin to foster self-directed behavior, which is the next bullet point, right? So I would also submit to you that in terms of approachability and communication and demonstrating empathy, less telling, more asking. So I would ask you to ask questions of the people who are on your team, ask for their input, ask for their insight, and learn from that, grow from that. The other thing is that effective leaders authentically want those around them to be better than they are, and that they're okay with that. That develops a sense of relatedness, which is one of the expected outcomes. And when there's high levels of relatedness, there is great result. When there's low levels of relatedness, there's very little result. It also helps as an expected outcome to provide for a respectful and authentic sense of teamwork. So everyone understands one another, they learn from one another. And then beyond that, the last point is that there's growth beyond your own capacity. It's very important to recognize that as a leader. Sometimes the ego might have you feel that you have to handle it all, and that's okay, I guess, to a certain extent. But eventually you're going to reach capacity, and when you reach that capacity, that's when breakdowns organizationally can occur. So what you want to be able to do is you really want to be able to delegate and want to be able to communicate and have people contribute to your life. So next. The last piece, which I think is critically important, is resiliency and awareness. Sometimes what happens is there's a disassociation from sense of purpose. And when that occurs, it's very critical to be mindfully aware, to take a step back and to get back in touch with the sense of purpose. You know, why is it that you do what you do? And why is it that you do what you do where you do it? And being able to answer that question is a very critical component, and will provide, again, once you get back in touch with it, an energy. You have to determine also where control has been lost. Oftentimes when there are issues around resiliency or the lack of resiliency in the moment, sometimes it feels as if control has been lost. So that's a very important thing to be back in touch with. Also be aware of reactions. I always share with people that what happens in reactions is we either gain power or we lose power within reactions. So an awareness, a mindfulness about that is critical. And then the last step here is be aware of self-talk. Something that I share all the time is that as you say it, so it shall be. And so you want to be careful about that. You really want to take time to examine what it is that you might be enrolling yourself in. If you're able to do these things and take these steps, some of the expected outcomes would be improved focus and energy, a sense of momentum and achievement for the group and the team and the organization, and an ability to maintain a proper perspective with consistency, which will have a very good impact on the organization. So with all of these distinctions of effective leadership and others, there are hours of developmental work and one-on-one guidance and executive coaching in order to achieve the desired outcomes. All of these, by the way, are things that we cover thoroughly within the program. And as Adam mentioned earlier, and I think that would be it. Adam, you're next.
Great. Thanks, Mike. So there's a lot there. I have a few more things to say as well, and obviously we'll have time for questions and answers at the end, and hopefully to dive a little deeper based on your questions into some specific areas. I had wanted to mention just a few other things, and in particular sort of tie in this concept of informed mindfulness. I think many of the concepts that Mike just touched on, which is really a combination of the awareness with a lot of the skills and knowledge that you need to be truly effective and ultimately be a cultural change agent, because that's what we're particularly interested in and is particularly powerful within organizations. And so I just wanted to touch on some thoughts related to that. The first one is to be effective as a cultural change agent, one needs to be open to change, and really the idea of creating a culture that is open to change. And that can be very difficult depending on the environment that you work within. Obviously, I work within healthcare, and higher education, academia, academic medical centers actually are some of the most resistant organizations to change. It's sort of between us and the military, from what I understand. And one needs to really work towards, I think, number two, which is building trust and achieving consensus around change creation to allow organizations to really evolve effectively. And those organizations that aren't able to do that, often end up not surviving, or certainly not thriving in the way that they could and should. I think a part of reluctance to change can be on the part of both organizations and the individual or individuals within organizations. This discomfort or inability at times to sort of step into the unknown, and sort of a discomfort with lack of what the future may hold, and wanting to sort of stay in this space where we kind of understand and have the control that we want. But the reality is that we need to be able to move and evolve and step in and lean into that, is the way I like to think about it. And as a leader within an organization that's looking to achieve that, you really need to lead by example and demonstrate a willingness to embrace the unknown. I think part of that also relates to the concept of lifelong learning, recognizing those areas where you might have difficulties, where you may need to continue to evolve your own thinking and own skills, and really encouraging others within the organization to do the same. The next one is probably, it's interesting, I'm sure many of you have read a number of leadership books and all these different sort of articles that try to look at the characteristics of effective leaders, and it can be quite diverse. I think one of the sort of my takeaways from looking at a number of those different publications is that it is this idea that one can't be afraid to take risks or fail. And of course the key being, and I think Mike mentioned this earlier, is learning from whether you want to call it a mistake or those potential failures, and in evolving as a part of that process. But staying neutral, not moving forward is almost always the wrong path towards success. Willingness to engage in the politics of the situation, I think, is very interesting, particularly interesting from the position of a physician. I think many that go into medicine, healthcare, like the autonomy that being in that role can bring. Of course, more and more healthcare providers, certainly more and more physicians, are becoming part of organizations. And, even within that scenario, though, one can still be relatively focused on an individual practice and working within that practice. But I think for the individual that's interested in leading, in really bringing about major change within the organization, dealing with the politics, both up and down, sort of the hierarchy of the organization is critical. And it certainly isn't for everyone, and some are better skilled at it than others, and again, like most skills, something that can be enhanced. But that it does relate, obviously, to the relationship piece that we were talking about earlier, and it can be quite frustrating, but it is the reality, of course, of any of the organizations that we find ourselves in, and one of the important components to address in order to ultimately be successful. I think able to keep an eye on the goal, and by that I mean focus is also particularly important. I also mean the long-term goal. What are we really trying to achieve? And I'll just give an example from my world. In sort of running, in this case, let's say the integrative program here at Duke, we obviously provide a number of services, not all of which are embraced by the medical staff. So some which may be a little more controversial, sort of complementary medicine, acupuncture, massage, these sorts of things. And again, I think the landscape is shifting dramatically, and there's broadened acceptance, and interesting to see, cupping done on Michael Phelps and all the interest that's sort of garnered. But still, there are things that if we chose to offer them here at Duke Integrative Medicine, could really alienate ourselves from the rest of the healthcare system. And so I've had many conversations with people that I may be hiring, let's say in this case, a massage therapist or an acupuncturist who I'm hiring to do massage, do acupuncture, who I have great respect for their capabilities as a healthcare provider, as a healing individual. But I'll still often say, you're being hired to basically do acupuncture, massage, and within a particular scope of practice, and that although you may also believe that hanging crystals from the person's ear may really help them, and, I may believe that too. And in the privacy, of your private practice, maybe let you hang crystals from my ears. But the reality is that within Duke Integrative Medicine, if we do start doing things like that, even though it may help a few individuals which is very important, it could ultimately undermine our greater goal of trying to truly integrate and help to transform healthcare in a way that is more inclusive, that really does try to address the needs of the entire patient and looks at the person as a whole person and not simply pathophysiology that needs to be addressed. And so, if the person feels obligated to be hanging those crystals, then please go do that in your private practice. But it doesn't fit here within Duke Integrative Medicine because of the bigger goals of what we're trying to accomplish. I think the last two bullets, building strategic relationships and alliances, from my perspective, it's an absolutely critical component to success. It's always an ongoing process, and it was very intentional to use the word strategic. It often feels a little awkward. I mean, there are relationships that I have worked on cultivating within the health system, individuals who I with authenticity and integrity, really like and enjoy being with, but also recognize that it's important for me to be in relationship with them if I'm going to be effective in my job. Because otherwise, you can't always be everywhere, and you can't always be influential on your own. You need to have those relationships where others can potentially represent you, if you will, within different areas of your organization, and understand what your competencies are and how you or your component of the organization can really bring about value to other components of the organization. And then the last one maybe doesn't need much explanation, but learns from the past, plans for the future while being present in the moment. I think that's really critical. Next. So I've given maybe already an example or two, but I'll maybe take just a few moments to share a few other examples. I've had the opportunity through certainly my work with Michael, the work that we've done through the leadership program, as well as other sort of opportunities and education to implement a lot of the things and to struggle with the implementation of a lot of the concepts that Mike has been talking about and that I've been talking about, and that's been great. And I don't mean struggle in a negative way. I think that's what we do: is we implement, we refine, and we see what's working and what isn't working so well, and we continue to try to move things forward. So I wanted to give a few examples. I could give many, but I was and I left this really open. I thought I would listen to Mike and in the moment try to come up with some examples that really would be consistent with what he was saying. And so there were many that came to mind, but I've written down a few. And one of the first things Mike was talking about was alignment, and alignment with vision and mission. And it really struck me how critical that was, and again, how critical it was for me when I first got here, now 5 years ago. September 1st to be 5 years. And initially, I now oversee our health and wellness portfolio, which is our fitness center, our diet center, and Duke Integrative Medicine. But initially, for the first 4 or 5 months, it was just Duke Integrative Medicine. And I knew coming in that we really needed to shift our model. We had a wonderful clinical model that largely was about people coming and doing 3-4 day immersions where they would see multiple providers. And we did offer individual consulting and things like that, but the core of the model in some ways was this immersion concept that was phenomenal. People would come and really leave with a whole personalized health plan, sort of their roadmap to really change their lives, to maximize their quality of life today and hopefully do what they need to optimize their vitality for the rest of their lives. And that was sort of the concept. Great concept. Of course, the problem with the concept was that it's expensive and that it was not really accessible to the majority of people out there. And so the model needed to shift, and I, again, a point that Mike had emphasized, I tried to start by, sort of listening and asking people, why they worked here at Duke Integrative Medicine, what were they particularly motivated by, what was their sense of purpose, what was the vision and mission of Duke Integrative Medicine. And what I learned was that people were particularly interested, obviously, in service to others as a part of healthcare, but in the case of Duke Integrative Medicine, particularly interested in being a part of a transformation of healthcare, a model that ultimately could influence in a positive way the way care is provided, certainly across the Duke system and beyond. And as I came to understand that, the messaging that I developed in sort of evolving ultimately our business model was that if that was our mission, then our current model, clinical model, was not going to really allow us to execute that mission, because our current model of immersions really wasn't scalable, by and large wasn't something that most institutions would look to or could even reproduce. And so that we needed to shift the model to something that was more accessible, more in alignment with the existing system, and more apt to then ultimately help to transform that system. So as a part of that, we began to take insurance. We brought in an integrative primary care practice and other things that allowed us to be much more aligned, made it much more comfortable for other providers to refer patients in. And what I continually emphasized was the alignment of that particular model with our mission, our vision, and as I understood it, our sense of purpose as an organization, and even in conversations with individuals. Of course, what happens as a part of that process is that if there are individuals who really didn't sign on for that particular way of doing things, then ideally, and as happened, they self-select and they realize that, this wasn't the bus for them, and they get off at the next stop. And that happened. We didn't lose many, but we lost some, and I think that was by design, and they went on to things that were more comfortable for them, and we, transformed the way we do things, and I think now, 5 years in, we're seeing great success because of that, including things like just having this year the highest work culture results within our entire health system, which was a real effort of ours, and having, record Press Ganey patient satisfaction scores, things that are really important to us as an organization and, of course, to the larger organization. So the second example I would give just briefly, but a little bit different, but it relates back to something that Michael was saying about expectations and sort of outlining expectations and how critical that is. And it's critical on a number of levels, and Michael was talking about a few of those, but I thought I would give an example because it actually was something I was just talking about. We had right before this webinar, I had one of my executive team meetings with leadership here, and was mentioning this and mentioning something that just came up, so around expectations, so I thought I would share it with you. One of the things that I've learned to do initially through Michael actually was, and this concept of defining expectations, was to take the organization through a process of defining what I call sort of our rules of engagement, really how we would define healthy communication and what our expectations would be around healthy communication, and spell it out. And so we went through this process with everyone as a part of a town hall meeting where, in fact, part of the conversation we had is we've now had some new employees since then, of course, and we need to kind of go through that again and recommit to this. But we basically, during that process, talked about, and I had a whiteboard, and we write words up on the board, how do we want to communicate effectively with each other? What would be our expectations of each other as it relates to communication? And ultimately, we came up with 5 words to define our expectations around communication. I actually took those and put them into a little laminated card. Certainly any of you work in healthcare, and probably many of you have to wear ID badges. Often underneath those ID badges, at least in healthcare, you have all these other ones that talk to what do you do in case of a fire and all these different things. So we made it up like one of those little laminated cards that can fit right behind your ID badge. But it basically says, with awareness, we will engage with each other in a way that is, and then we list these 5 words: kind, honest, respectful, direct, and timely. And I've used this, and at times even pulled it right off of the ID, in the moment when needed, as certain situations have arisen. And part of what we do is after we define that, we all say, can we commit to this? And we commit to it. So now we have a defined expectation around healthy communication. And so I'll give an example that just came up the other day. I had I was meeting with one of my fairly high-level direct reports, and this individual shared with me that another colleague who he works very closely with, had made a comment that basically it hurt his feelings. I think he found it somewhat insulting. There was almost an implication that maybe there had been some dishonesty or manipulation on this person's part, and it had been really bothering him. And the comment had happened 2 or 3 weeks ago, and it clearly was really affecting him. And he shared that with me, and how much it had been bothering him. And rather than call up that other individual or whatnot, I basically reminded the employee that I was speaking with about our rules of engagement, and said, knowing the other individual the way I do, I would suspect that he has no idea that the comment had the impact that it did. Certainly, it's unlikely had that intention. However, based on what we've defined as expectations of each other, this is why we need to go directly to that person in a timely fashion, so we don't let things ruminate, right? But also in a respectful, honest, and kind way, and let them know how the comment affected this individual, and talk the situation through. So I had that conversation at around probably was the middle of the day, and by early evening that night I got an email that actually maybe came the next morning, but I got that evening. That's exactly what this individual had done, had gone, had the conversation, it had gone very well, and sort of really things were back on track. So a little bit more difficult to do if those expectations hadn't been clearly defined. And I think those kind of things have had a real positive impact on our work culture, and it led to sort of the extraordinary results that we've seen now with the progress we've made with our work culture. And I think by extension reflects on our patient satisfaction scores too, because I think employees that feel really good about the work environment, create a really good environment for those customers, in our case patients and others that we serve. So with that, I think next, I want to make sure, I've been talking for a while, that we leave time for questions and answers at the end. Some of you may have questions about the leadership program. As you can see on the screen here, there's a website, integrativehealthleaders.org, where you can find the pebble in the pond, and you can find and answer probably many, if not all, of the questions you might have. There's also videos explaining different components of the program. So I will leave you with that, and perhaps now, Tamara, turn it back over to you for questions and answers.
Thanks, Adam. We have a few questions in the queue. As a reminder, to ask a question, submit your text question through the Q&A section of your attendee control panel on your screen. Our first question is Michael. Michael, you mentioned a culture of accomplishment. Can you explain briefly what that is?
Well, absolutely. Thank you for asking the question. I can tell you that there are many, many components to creating a culture of accomplishment, but at the very core of it, there is I mentioned earlier, there is focusing on what's right, or basically, to put it another way, validating what's right. In human nature and in organizational development and so on, there's a tendency to focus on what's wrong. And what I can share with you in human nature and through my observation and experience, what I see is that what we all tend to focus our thinking around brings on more of what we're focused on. So if we can learn to sort of shift that thinking to validating what's right, acknowledging what's right, appreciating what's right, speaking about what's right, and so on, what happens is it brings about more of that, which is kind of interesting. And I also would say, too, that another very critical component of that is as a leader, mindfully creating and fostering self-directed behaviors and ownership within individuals who are part of the team. Both of those things are very, very core to the outcomes of what developing a culture of accomplishment is all about. What it does when it takes hold, and it takes time and it takes effort, but what it does when it takes hold, you've heard Adam mentioning a number of different circumstances and situations where it's actually working, but it does increase efficiencies and it improves very much so organizational collaboration. There are always much higher levels of productivity, and it leads to better retention and improved morale, spirit, and so on. So it's very close, very important to really sort of, again, acknowledge and appreciate openly as a leader what's right and what people are doing that way, because it will bring on more. So that's what the culture of accomplishment is about. Now, it doesn't mean that there isn't a degree of accountability, because if you remember, one of the things I mentioned earlier was that the framework of accountability is defined, the expectations are defined, and so on. It doesn't mean that by focusing on what's right, that you completely forego any level of accountability. I want to make that clear. But it definitely will bring about a sort of compelling energy within the organization, and we just heard examples from Adam. So thank you for asking.
Of course. Okay, our next question is for Adam. A few of today's attendees are wondering, what is the format of the leadership program, and any guidance on who should apply?
Okay, sure, happy to answer that. Maybe I'll try to do it relatively briefly because, again, there's a lot of information online, so let me not take up too much time, but let me say that it's a year-long program. It involves some initial pre-work, but then people come typically in February for 3 days to Duke for an immersion. It's work with the core faculty, Michael and myself and others. And then after that, and we usually have guest speakers, and after that, there is 6 months of online education. We've actually built over 40 modules. We've used faculty from across the world, really. And the curriculum is sort of bunched into 4 main areas. There's content on leadership and strategy. There's content more specific to integrative health and healthcare environments. There's content on communication and business operations. And then, again, some content more specifically on health and well-being. After that 6 months of online education, the group comes back to Duke for some more experiential immersion work. At that point, they are also paired up with a mentor from Fuqua, which is Duke's business school. And then you go off for the final 6 months and work on really the final project, which is a critical piece, which is a business case or a business plan that you can bring back to your organization. It could be, specifically to build a particular program. It could be around some sort of change creation project that you're looking to implement. But ideally something that you develop not only with the mentorship from Fuqua, but with collaboration within your organization, and with the idea that you can bring this back with this support to hopefully implement it and bring about whatever change you're looking to bring about or create what you're looking to create. And then usually at the end of that period you come back for an opportunity for graduation, but also to sort of present your final project and get some feedback on it. So it's really great. And, I think the other piece was who should apply. And, ultimately, what the intention of the program was to really help develop leaders who can bring about transformations within their organizations. And there was a specific focus on healthcare. I think there is integrative healthcare is in the name, and that's certainly critical, but I think it's more drawing on some of the broader principles of integrative healthcare that really can apply quite broadly to various organizations. So certainly we get healthcare providers, physicians, nurses, others. We have a dentist this year. We have physical therapists that are interested. We also have, we've had a CFO from a healthcare system. We've had a number of health consultants. We've had people that have been on the more corporate medical director side, some individuals that work within wellness, HR, and benefits within their organization. We have the head of HR from a bank this year, for example. So it's really quite a broad group. I would say the one thing that it isn't typically is, let's say, that clinician who's just graduated from, their fellowship or whatnot. And typically it's individuals who are at a position within an organization or institution where, again, they could develop some sort of final project like I've just described, and be in a position to go back to that organization and implement. So that's a critical component that we're looking for.
Okay, great. One of our attendees is currently initiating an integrative medicine program and have proposed to take a leadership course to facilitate the guidance of the program. They want to know, they're moving forward now, will this program add to their toolbox? Do you want to start?
Me, is that what you said? Oh, I couldn't hear you. Was that me, Tamara, or Michael?
Yes, please start.
Okay. That could be a really short answer, and I could just say yes. It certainly would. I mean, again, this is if there is a sweet spot, so to speak, to the program. I mean, I think in the initial intention, it was for that individual that's looking to develop a health and wellness or an integrative program, and it could be within a healthcare system. It could be within a large self-insured entity or some other organization. I will say that as we kind of got this program off the ground, and we're actually halfway through the second cohort, we're just now there's about another month and a half where the applications will be open for the cohort number 3. We've really recognized, and there's been such broad interest, we've recognized how applicable the content, the education is sort of across a number of kind of industries. But this is a chance to take some of the concepts that Mike and I have been talking about and much, much more, and really dive into it for a year and develop as an individual, but also, get the mentoring from what, at least last year, I think was rated the #1 business school in the country, and you're getting the mentors that the Fuqua students get. So there's a lot of refinement of self, a lot of refinement of leadership and business skills that would definitely lead to a greatly enhanced toolbox.
Okay, great. Our next question is for Michael. One attendee is wondering, through your experiences, what do you feel are the top traits or attributes of effective leadership?
I'm actually very happy to respond to this one. It's the exact substance and subject matter of a book that I'm currently writing. So there are many to take into consideration. It's been my observation learning that the key traits or attributes revolve around vision, as we mentioned, and being visionary, which we just covered. That true sense of purpose and intention is so critical. It's one that needs to create energy and call forth an energy, if you would, from the people who are part of it. Effective communication is required at all levels. Without it, things will probably not be as productive as they could be. And ownership and accountability in all that is done by everyone is a critical component, and also a very high degree, as we talked about a minute ago, and Adam also brought up, of connection and relatedness with others. It's just so critical. But I know you asked for 5, but I think there's 6, and I mentioned it earlier, but resiliency is I think, such an important component to effective leadership as well. In our ever-increasing world of demand, I find so many folks who are at their capacity or beyond their capacity today, and so it can be daunting. And I see it that it can also cause a true sense of overwhelm and anxiety. But interestingly enough, a lot of us don't want to let anyone down. So it's quite a dichotomy. And so being resilient, I think, and developing resiliency, by the way, is paramount in order to derive successful outcomes. So thank you.
Can I just make one related comment to that, because it sort of occurred to me as I listened to Mike speak that we actually haven't said this term, but it's so relevant and so prevalent nowadays, sort of challenges with work-life balance, and I actually prefer the term work-life integration, and this idea and some of the concepts that Mike was just mentioning, from sense of purpose to resiliency, and how critical that is, and how so many are struggling. So we're actually taking, here at Duke, we're taking some of the work that we've done with the leadership program and developing a program that we're piloting with some of our healthcare providers around how do they become more resilient, how do they get a better sense of work-life balance, work-life integration, and certainly things like putting those things that you choose to do through your purpose and meaning filter before you say yes or no, is critical. But many other concepts that I think are so important in multiple settings nowadays where people are feeling, really kind of burnt out.
Thank you. Okay, we have no other questions in the queue. So with that, I'd like to, Michael, Adam, any final remarks from you before we close today's webinar?
I would say that be mindful that it's all in the approach. As you say it, so it shall be. So if you can just employ that and practice that, I think you'll see greater outcome.
And I would just add my thank you for everyone for joining us, and I hope that they had some good takeaways from today, and again, it was a pleasure.
Thank you.
So this concludes today's webinar, but I wanted to thank you all for attending and your participation. A recording of the presentation will be available on the Leadership Program website at www.integrativehealthleaders.org by early next week. As a reminder, the Leadership Program in Integrative Healthcare at Duke University is accepting applications for our third cohort beginning February 2017. The application can be accessed through our website, and the applications will be accepted through September 30th. Thank you all so much. Have a great day.